The human body is this incredible piece of engineering, right? But what happens when that brilliant design actually creates a problem? Today we're going to dive into a really fascinating set of rare conditions where our own internal anatomy, the very stuff that's supposed to keep us alive, ends up getting in the way.
So what happens when your body's design creates an internal traffic jam? I mean, seriously, imagine that. But instead of cars, it's your own blood vessels and organs getting all jammed up. It's a bizarre medical mystery where the body's own architecture starts putting the squeeze on itself, and that can cause a massive system-wide backup.
And really, it all boils down to one simple thing: pressure. Pressure in places where it just shouldn't be.
The official name for this whole category of issues is vascular compression syndromes. Now, while some people are just born with the anatomy that sets them up for this, these conditions can also pop up later in life. And believe it or not, a really common trigger is rapid weight loss, because that can shrink the protective fat pads cushioning our organs, leaving them totally vulnerable.
Okay, so here's the deal. These syndromes pretty much play out in two main ways. In the first scenario, a blood vessel is the victim. It gets squeezed, which can either starve an area of blood or cause a really painful backup. In the second scenario, the blood vessel is the villain. It's the one doing the squeezing, blocking off a completely different part of the body. Let's take a look at a key example of each.
First up, we've got a condition with a name you are not going to forget: Nutcracker syndrome. And trust me, once you see what's going on inside the body, you'll understand just how fitting that name really is.
To get this, we need a quick anatomy lesson. Let's meet our two main players. Here we have the abdominal aorta. That's the main highway for blood leaving the heart. And one of its major off-ramps, the superior mesenteric artery, or SMA for short.
Now check this out. This is where things get really tricky. The left renal vein, which is draining blood from the left kidney, has to navigate this super tight space, right between the fork created by these two powerful arteries. It's a design that leaves almost zero room for error.
For most of us, the angle between these arteries is wide enough for everything to flow just fine. But in Nutcracker syndrome, this angle can shrink dramatically. We're talking sometimes to less than 6 degrees. I mean, that is an incredibly tight squeeze.
And right here, you can see exactly why they call it that. The aorta and the SMA are acting like a literal nutcracker, pinching that renal vein closed. Blood can't drain from the kidney properly, so it backs up, creating this dangerously high pressure inside the kidney itself. This can cause tiny vessels to rupture, leading to blood in the urine. That pressure can even back up into other connected veins.
So all of that crazy internal drama shows up as some very real and very painful symptoms. We're talking intense pain in their left side, seeing blood in their urine, feeling nauseous, and for biological males, it can cause something called a varicocele, which is basically a varicose vein in the scrotum from all that blood backup.
Now here's where it gets really wild. The exact same two arteries, that aorta and the SMA, can cause a completely different kind of problem. This time it's called superior mesenteric artery syndrome, or SMA syndrome. And this is the fundamental difference, right here. In SMA syndrome, the victim of that squeeze isn't a vein anymore. Nope, it's the small intestine itself. Specifically, a section of it called the duodenum gets trapped and pinched shut.
So, you might be wondering, why on earth does this happen? Well, the main culprit is the loss of a critical piece of internal padding, the mesenteric fat pad. This little cushion of fat normally props that angle between the arteries open. But with really rapid and significant weight loss, whether it's from a serious illness or an eating disorder, that fat pad can just shrink away, causing the angle to narrow and clamp down on the intestine.
And this right here is the smoking gun for doctors. On this actual CT scan, you can see it plain as day. The duodenum, which is part of the small intestine, is being squashed completely flat between the superior mesenteric artery and the aorta. That's the visual proof of a major intestinal blockage.
So with these strange, sometimes overlapping symptoms, how do medical teams actually figure out what's going on? Well, it's all about playing detective and putting together the right diagnostic clues.
This table gives you a great snapshot of how doctors use advanced imaging to find the specific problem. For Nutcracker syndrome, they're looking for that narrowed vein, what's called vein stenosis, and reduced blood flow on a CT or ultrasound. But for SMA syndrome, that same CT scan is going to show the squashed intestine instead, and an X-ray might show this hugely dilated gas-filled stomach that's just stuck behind the blockage.
And get this, there's a really unique physical clue for SMA syndrome, something you can actually hear.
A doctor might listen to the abdomen and hear something called a succussion splash. It is literally the sloshing sound of fluid and gas trapped in the stomach, unable to go anywhere. It's a surprisingly low-tech sign of a very serious problem.
So how in the world do you fix a problem that's literally built into your body's own plumbing? Well, the solution is often surprisingly straightforward. You have to restore the body's natural cushion.
For SMA syndrome, the game plan is pretty clear. First things first, you have to relieve the immediate pressure. That usually means putting a tube in to decompress the stomach and giving lots of fluids. Then, the real work starts. Getting nutrition into the body, often with a feeding tube that goes past the obstruction, all with the ultimate goal of helping the patient gain weight.
And this is the real kicker, the crucial takeaway. For so many patients with either Nutcracker or SMA syndrome, the most effective, non-surgical treatment is exactly the same: carefully managed weight gain. By rebuilding that internal mesenteric fat pad, you can physically pry that angle open between the arteries, relieving the compression and solving the problem from the inside out. It's amazing.
It's just a powerful reminder of all the delicate, intricate anatomical balances that keep us healthy every single day. And it really makes you wonder, what other delicate balances are hiding inside of us, perfectly calibrated, just waiting to be discovered?